All right, today we're going to be talking about erythema nodosum, what it is, when it occurs, and I'm going to share a little bit of my own personal experience. But first, I'm Ashley.
And hello, I'm Danielle.
And we're the Crohn's and Colitis dietitians. We're here to make nutrition easier and a little bit more fun and less conflicting. So let's dive into what is erythema nodosum.
It's a mouthful, honestly.
Right.
I feel like it took me a while to pronounce it properly, but it has to do with your skin. And it is one of those extraintestinal manifestations that can happen in IBD. They're bumps under your skin, and it's the inflammation of fat.
Yeah.
Right? Yeah. So some people may feel pain and this tenderness. They're usually like a couple centimeters in diameter, I believe, and they may also be raised bluish red lesions. So it's something that I feel kind of resembles like bruises on the skin, but probably a little bit more painful. It's common in Crohn's disease and ulcerative colitis, affecting 3 to 10% of people with UC and 4 to 15% of those with Crohn's disease. It's often involved when your IBD is not doing its best, meaning when there's inflammation present in your intestines as well. But there is a chance that it may also be present when your intestines are in a good spot or when you don't have any inflammation.
Yeah, because it can have many different causes. Sometimes streptococcal infections can cause it. Sometimes there can be no known cause, but like when you have IBD present, that would be the likely consideration, right? In my own personal experience with it, I didn't know what I had at first. This was back when I had a really bad flare. I had been in the hospital, and I think originally they thought it was Lyme disease. It was a giant nodule below my knee, which is like a classic erythema nodosum sort of presentation. But, when you're in a hospital setting, oftentimes they're looking for these acute life-threatening things to try and solve the puzzle. And oftentimes a lot of the chronic stuff sometimes gets missed because it all depends on what you're looking for. Whereas if you go see like an IBD specialized GI who maybe sees it all the time, then they're going to be more prone to be going down that path of knowing what it is. So for a while, I didn't know what it was. All I know was that it was really, really painful. Like I had gone to the orthopedic doctor, they touched it, and I mean, I essentially screamed. It was just so painful. And I also had a lot of inflammation in my leg, and I had a lot going on at the time. And it's another reminder that IBD is not just in your gut. Like this can affect your whole body. And I think especially when it's not controlled, sometimes if you're somebody that doesn't present with a lot of symptoms, you might not know that you have ongoing stuff until you have some of these outside the body presentations. So yeah, that was my experience with it, is that I didn't know what it was for even a year after. It wasn't until talking to more specialists in the IBD space that I realized, oh, that's what it was. It wasn't actually all these other lists of things that we thought it was, but actually more IBD related. And then when we did treat the IBD, it did go away pretty quick compared to, when I was in the hospital. You're treating it like it looks like Lyme because it's circular. So Lyme presents as a circular red, and sometimes you can see like a ring around that. But yeah, we did treat it in one way, and I haven't had it since, thankfully.
Woo. Yay, good. Because just to hear you say that you just touch it and you're in agony.
Yeah, it's wild. So if you are dealing with that, definitely get some support from your GI. Make sure you're on the right treatment plan for you. And yeah, and if you're going through it, I'm sorry you're going through it, and I hope that you find some relief soon.
Mm-hmm. And don't forget too that if you need some help in the nutrition department with your IBD, that is what we are here for. So we thank you for listening. You can check out the link below to learn how to work with us. You do deserve it. You do not have to go through all of this with no help. We are here for you, and thank you for listening.
All right, take care.